Flown from China, arriving in Scotland. 10 million face masks, infusion pumps for intensive care units, virus collection kits. PPE stocks in Scotland currently at 2 weeks. In parts of England with just-in-time supply chains unreplenished, some items could run low in days. The promised delivery from Turkey has been delayed. Frontline health workers across the entire UK are worried, to say the least.
There will be some situations where surgeons will be asked to do things without appropriate PPE, and we think that's very disturbing.
Because we work in such an uncontrolled environment, it's not like a hospital where we can control amber and red zones. It's a very uncontrolled environment, and staff are just very keen that the PPE they need, one, is available for them when they need it, and two, is appropriate for the level of exposure they're going to have.
I think it is important to remember that although there may be elements of distribution problems across the UK at different times and in different places, this is a huge pull on services which we have never seen before.
The number of COVID infections and hospital admissions continues to flatten, but the latest stats, nearly 600 more people have now lost their lives in hospitals, a total of over 16,000. The government simply acted too late, claimed a newspaper investigation today, quoting several unnamed Downing Street sources. And minutes from the UK's key pandemic panel make grim reading for number 10. On the 21st of February, the New and Emerging Respiratory Virus Threats Advisory Group, or NERVTAG, kept the coronavirus threat level at moderate. Repeat, moderate, despite warnings to raise it from at least one member, John Edmonds. JE believes that the risk to the UK population should be high, as there's evidence of ongoing transmission in Korea, Japan and Singapore, as well as in China, record the minutes. And NERVTAG had previously recommended improving supplies of things like PPE and ventilators, following Exercise Cygnus, a pandemic response rehearsal conducted back in 2016. It cited the need to strengthen the surge capability and capacity in operational resources in certain areas. This was particularly true for excess deaths, social care in the NHS. A former minister involved in Exercise Cygnus at the time says the government has been asleep on the job.
The senior minister responsible for the Cabinet Office is Michael Gove, and the Secretary of State for Health is Matt Hancock. Did they read the Exercise Cygnus report, yes or no? If so, what did they learn from it? Did they conclude that we were well prepared for this pandemic? If so, why? And if they concluded actually that we did have a PPE kit problem and a ventilator capacity problem and a testing capacity problem, then why did they not act in January?
And what of the Prime Minister himself? During those crucial early days in January and February, he didn't attend 5 Cobra meetings. But Michael Gove this morning playing it down.
He didn't, but then he wouldn't, because most Cobra meetings don't have the Prime Minister attending them. That is the whole point.
Not good enough, says the Shadow Health Secretary.
But there are serious questions as to why the Prime Minister skipped five Cobra meetings throughout February, when the whole world could see how serious this was becoming. And we know that serious mistakes have been made.
Mistakes on forecasting, mistakes sourcing PPE, on testing, on tracing. And now the UK is dealing with the consequences. How and when to ease the lockdown. And when, for example, to reopen schools. But there is, as yet, no date.
Well, joining me now is our political correspondent, Liz Bates. Liz, this morning, Michael Gove promised a detailed rebuttal of the Sunday Times article, which is a series of detailed allegations about what the government did or didn't do in the early stages of this pandemic. Have we got it yet?
No, we still haven't got the rebuttal. As you said, I mean, we were expecting it probably an hour ago. I'm sure that we will get it at some point. There's a lot of anger, actually, I think, in number 10 about this article, and that is because it is particularly damning, it's particularly detailed, it goes over the timeline, and it's especially damning about the Prime Minister's role in all of this, picking out the fact that he didn't attend key Cobra meetings, that he was working away from Westminster at crucial moments. The overall picture of a leader that was disengaged at a really important time for the country, and that inhibited the UK's response to this crisis.
Parents up and down the land are looking forward to the restarting of homeschool tomorrow because the kids aren't going back to school. What do we know about this decision and when it's happened?
So what we know about this, what was interesting about this issue is that we saw a report today splashed on the front of the Sunday Times to say that we could expect schools to be returning within 3 weeks. Now, you would expect a story like that on the front page of a big newspaper to have come from quite a good government source. But this morning we saw Michael Gove saying that that wasn't true. Number 10 have been saying to me that it's a load of nonsense. And when the Education Secretary was asked about it at the press conference today, this is what he had to say.
People are anxious to know when we're going to relax restrictions, when schools are likely to be fully back and open again. Of course, I want nothing more than to see schools back. Get them back to normal. Make sure that children are sat around, learning and experiencing the joy of being at school. But I can't give you a date.
So what's interesting, I think, about this particular issue is that there's potentially a bit of a power struggle going on behind the scenes here. This suggestion that schools were going to come back in 3 weeks and then immediately slapped down by number 10 today. So, you know, these are sometimes maybe the kind of things that happen when you have a Prime Minister that isn't in post at the moment, and potentially a bit of a power vacuum. So we're seeing what's going on in private being played out in public here.
But one of the big crises in hospitals is the availability of PPE.
Yes.
What's happening on there?
So on PPE, in the press conference today, lots of questions, understandably, because we've seen many stories still coming in of health workers without the right protective equipment. We're hearing lots of different stories. We know that the UK sent PPE to China back in February. There's also this shipment of gowns supposed to be coming in from Turkey that has never arrived. Today, Dr. Jenny Harris was saying we need to have an adult conversation about this. When I asked the Education Secretary about it, he couldn't say whether every health worker would be safe, but did say that the government is doing its best to get this protective equipment into the UK. It did sound like what you were saying on PPE was we're trying our very best, but we still can't really guarantee the safety of every frontline health worker.
We recognise that there are key areas of pressure within PPE, and as Jenny touched upon, the pressure points have actually shifted over the last few weeks in terms of what types of PPE are required. We recognise there's a big pressure, but what I do want to assure you and all your viewers that we're doing absolutely everything we can to bring as much PPE in right from across the globe.
Well, that was Gavin Williamson. Liz, thank you very much. Now, as the Chief Scientific Advisor, he dealt with crises including the foot and mouth disease outbreak, but now Professor Sir David King says he's shocked and saddened that the UK has failed to respond quickly to this pandemic, and he wants the government to be more open and honest with the public. Sir David King joins us now. So, David, could you explain what you mean in terms of why we weren't prepared?
Well, I think what is very disappointing is quite simply that Britain was in the lead in the area of being in preparation for a pandemic of this kind. And certainly we were in the lead in giving advice, for example, on the SARS outbreak in Asia, the avian flu outbreak and so on. We were the experts and we were the leaders. And when I led a team in 2006 that left a very big footprint in government saying what we needed to do in preparation for a pandemic of this kind. And as we've heard, the Cygnus report came out, it was reported to government in 2016. So what has happened? Well, I think that two important things have happened. One is, of course, the austerity measures introduced in 2010 meant that all of these preparations, which are preparations to risk manage for the future were essentially jettisoned in favor of dealing with current crises because there simply wasn't the money available. But the second, and I think very important factor that also changed in 2010 was the kind of command and control policy where effectively Number 10 and its communications people control who says what in the public domain. And by this, I'm particularly referring to the position of a chief scientific advisor. When I was in government, I was called by television and radio very frequently, and I almost always accepted, and I was free to say what I wanted. And the reason is because I had already expressed my desire to show to government that I was an independent science advisor and that I would be able to attempt to get the trust of the public in what advice I was giving by giving the advice to government and then putting that advice into the public domain. Now, I am, for example, today delighted to see that Patrick Vallance, the current chief scientific advisor, has got a really good article on the potential for a coronavirus vaccine to be developed and what procedures were in place in the UK. I would like to see the ability of science advisors to stand up and say what it is their advice is they're giving to government.
Okay.
And I'm afraid that has not been in place for a long time.
Sorry to butt in, but you will have seen the Sunday Times article today. Look, is this just easy hindsight? You know, we can all be clever after the event, or were there serious warnings from the WHO at the end of January, before and after, that the government should have acted on?
Well, of course. The first serious warning, frankly, is what was happening in China at the beginning of January. And what we needed to do was keep an eye on that, because any new virus developing, which has a high death rate and which is highly infective, the infectivity rate of this virus is very much higher than the normal flu virus. As soon as we knew all of that, we should have been putting into train all of the procedures we needed to see happening. And I'm saying by the end of January, we should have been acting in this way. Now, I'm not using hindsight. I'm simply going to say to you, what was Germany doing at that time? What was Singapore doing at that time? What was Greece doing at that time? These were countries that were responding properly to the information and the advice that was coming through to them.
OK, let's just come to the now and what we should do. The best practice is now widely regarded as a sort of as a test, trace through the use of technology and then isolate kind of policy, which the government isn't yet talking about. Do you think they are still not doing the right thing?
We would very much like to see in the public domain an open discussion on the level of testing that we can achieve, the level of contact tracing, whether or not it's too late to go into the contact tracing and testing at this level in order to bring things under control. And if it is too late, what are the policies? Now, this is why I was welcoming Patrick Vallance's article on vaccine and vaccine production and delivery. We need to be focusing not only on our laboratories to see that we produce vaccines in this country, but also internationally, but also look at vaccine production capacity. We do not have the vaccine production capacity in this country. Are we gearing up to get that in place now?
David?
So that
I'm sorry to cut you off. Sadly, we've got to move on, but thank you very much indeed for your time. Hope we can talk to you again soon. Well, I'm joined now by the former Deputy Prime Minister, Damien Green, who the Conservative Party have suggested we speak to tonight to discuss these issues, and the Shadow Minister for the Cabinet Office, who shadows Michael Gove, Rachel Reeves. We'll be speaking to her in a moment, but first to Damien Green. Well, you will have just heard the former Chief Scientific Advisor, Sir David King, say that there were several things that the government should have acted on early on. And we've now had it laid out in this remarkable article in the Sunday Times. This is important stuff, isn't it, to recognise?
I think the point that the former Chief Scientific Advisor would agree with, I'm sure, is that ministers should listen to their scientific and medical advisors. And what the Sunday Times reveals, not the reporting of it, but actually if you read it, is that throughout January, February, the government was listening to its scientific advisors. The point was made actually in your report that in the middle of February, the committee that reports into SAGE, the scientific advisory group that we now all know about, the specific viral, if you like, report into that said that the threat level was moderate.
This sounds like shifting the blame.
No, I'm not shifting. I'm not blaming anyone. That's, I think, the root of this is the desperate search for someone to blame. Scientists were faced with a phenomenon they'd not been faced with before, and they made their best honest recommendations to ministers who listened to those recommendations. If ministers had ignored recommendations from experts, then genuinely you'd have somebody to blame.
Well, there were reports. Hang on. There were reports that went to government that warned of thousands of deaths if drastic action wasn't taken, that this was all quite possible. And instead, we saw Boris Johnson going around shaking hands with coronavirus patients, making speeches in early February about how Britain could be the Superman as the rest of the world locked down, and not attending Cobra meetings and sending his health secretary there instead.
Well, first of all, there were not reports coming in. There were individual scientists had different views, but the consensus reports coming from the expert committees suggested what the government should do, and the government did this. And the point about Cobra, it's simply factually untrue that prime ministers always chair Cobra. When I was first secretary, I would quite frequently chair Cobra.
But it shows how serious you take it.
No, it doesn't. The Prime Minister, at every stage, the Prime Minister and the government machine has acted on the recommendation of their scientific advisors as fast as those advisors recommended they do. That seems to me to be the sensible thing for any government to do.
Jamie and Green, thank you very much indeed. Let's talk to Rachel Reeves now. Is this the beginning of a sort of a rather tasteless, in some people's view, search for blame?
Well, look, everybody wants the government to get this right because it's in our national interest that the government does respond. It's obvious that mistakes were made at the beginning. We did lock down later than other countries, and I believe that that was a mistake which cost us time. It's also the case that in terms of our testing, which is still nowhere near the levels that the government say that they want to achieve, and in terms of procuring and distributing the personal protective equipment and clothing, that we're not where we need to be. But we need to work together to try and find solutions to that, and that's very much the approach of my party, the Labour Party.
Do you want to have a more open conversation about how we get out of the lockdown than the government is having?
Yes, I think there's a whole number of issues now that the government need to focus on and be more honest with the public about. And those issues are getting the personal protective equipment and clothing to the front line of our NHS and our care sector, as well as transport workers and those in supermarkets who need to be protected to stop them from contracting this virus and then passing it on to others. There's a big issue with the testing that we're still now more than halfway through April at only 21,000 tests, not the 100,000 a day that the government had committed to by the end of this month. And indeed, in terms of the lockdown, where we still don't seem to be any closer to having an idea about the phasing which these restrictions might be lifted over time. Nobody thinks that we should end the lockdown now. It's right to have extended it by 3 weeks. But the public want to be levelled with and want to have some idea that there's some light at the end of the tunnel and how the government are going to approach that phasing out of those restrictions we're living under at the moment.
Rachel Reeves, thank you very much indeed. Now, the pandemic hasn't only changed the way we live, it's changed the way we look, with increasing numbers of people wearing face masks when they're out and about. Last week, we discussed the arguments for and against the use of masks, but with the government reluctant to tell everyone to make them mandatory without conclusive scientific evidence, Anya Popp has been speaking to one scientist who says the evidence is already strong enough.
As countries across the world lock down and cover up, the question in the UK over whether to wear a face mask or not is still being debated.
There's a whole load of different things to look at, and the scientists happily are looking at that right now, and I'll take their advice, and we'll then be able to issue much more, I think, scientifically based advice rather than jumping to wrong conclusions.
But leading scientists say waiting for evidence could cause more damage than going ahead without it.
We're going to have to wait for quite a few deaths to occur before we get the evidence stacked up to support 100% a policy of wearing face coverings. Now, I don't want that to be any of my relatives. Now, you could say, well, maybe nobody would die. We don't actually know for sure whether mask wearing would work. And I'd say, yeah, sure, but we've got a lot to lose if we get this wrong, haven't we? I don't think we're going to lose very much if people do wear face coverings. I don't think it's going to kill anyone.
Professor Tricia Greenhouse says that scientists have been concentrating on evidence of how well masks protect the wearer. But her studies show they're most effective at preventing infections spreading from the person wearing it. And in the absence of hard evidence that policymakers say they need, she says natural experiments suggest covering your nose and mouth can stop the spread. Take the European neighbours, Austria and the Czech Republic, for example. They both introduced social distancing on the same date, but the Czech Republic also introduced mandatory mask wearing. And watch what happens. The Austrian case rate continued on an upwards trajectory, and the Czech Republic flattened out. Weeks later, when Austria brought in the same face covering requirement, the two countries returned to similar trajectories.
Wearing face coverings is going to be one way that we can all get back to work, sooner. I was on a programme yesterday with a policymaker who said the best barrier is your own front door. Well, that's all very well, and I agree with that, but that means lockdown's going to last forever. If we want to come out of lockdown, let's take that front door in front of our face and let's just wear a face covering.
In a world where normality has been lost overnight, that crucial question of what the UK will look like once we're allowed out again. Could images like these become the new normality in the post-lockdown world?